Welcome to the next episode of the Hormone Café. Today we're going to talk about the uterine lining. Why your uterine lining is important, what are some red flags that could mean you have an abnormal uterine lining, what are the different diagnoses that we can have that means a disruption in our uterine lining, and then how do we treat it? So what is our uterus lining? The medical word for your uterus lining is called your endometrium. And your uterus is actually a really thick muscle. So if we think about an orange, it's like the peel of the orange, whereas your uterus lining or the inside of your uterus is more like the fruit of the orange, where it's a lot softer and thinner and more delicate. Every month, your estrogen will increase and that grows your uterus lining. And then after you ovulate, your body makes progesterone and that stabilizes your uterus lining. And then the withdrawal or decrease in your natural body's estrogen and progesterone production causes you to have a period. And that's where your uterus lining, which turns into your menstrual blood, that's where it gets shed. So the cycle every month is that we grow our uterus lining, we stabilize it, and then we shed it. So what are some red flags that we might have of unhealthy uterus lining? So one is if we have too light of a flow. So we always want our flow to be at least 3 tampons per cycle or at least 30 millimeters of blood. And we want the flow to start bright red. We don't want it to start with spotting. And we also don't want to have any mid-cycle bleeding. Because if we're bleeding around the time of ovulation or bleeding in our luteal phase before we have a true period, that could mean that we have an unstable uterus lining or what we call a weak uterus lining. Or if we have way too heavy of a flow, that could mean that we're growing way too thick of a uterus lining and lots of clots are coming out, and that if we're having a blood flow that's greater than 80 milliliters, that could also be a red flag. So cycles that are too light, cycles that are too heavy, or mid-cycle bleeding can all be problems with our uterus lining. Other issues is if we have recurrent miscarriages, that could be an issue with our uterus lining. If we have unexplained fertility or we've been trying for a long time and there's some things that we haven't checked into, we always want to check into uterus lining. If you've ever had a procedure or an IUD, sometimes having an IUD can cause some damage to your uterus lining. Or if you've ever had a procedure like a DNC, for example, that can cause some scar tissue. So a lot of different things that can cause uterus lining issues and things that we need to look into. So how do we look at your uterus lining? One is that it's really important to know what your hormone profile is. So we always want to check your hormones before and after you ovulate. And then we want to correlate that with the thickness of your uterus lining on an ultrasound and what the blood flow looks like to your uterus. For example, you want to have a certain amount of estrogen that grows your lining. And ideally for implantation, we want to have a lining of 6 to 7 millimeters at least, especially around the time of ovulation, or higher than that. It could be 8 to 10 millimeters. When we look at the thickness of your lining on an ultrasound. So if you're a person who has really high estrogen but has a really thin lining, then we worry what's going on with the estrogen receptors in your uterus. Why isn't your uterus lining seeing all that high estrogen? Or there are some people who have really low estrogen but have a really thick lining, and then we think, why are there more estrogen receptors in your uterus? Or is there a blood flow issue where you're just having way too much blood flow to your uterus and that's not necessarily reflecting estrogen that we see in your blood? So we want to know, what does your hormone profile look like? What is your estrogen status? And then how thick does your endometrium look on an ultrasound? The other evaluations that we'll often do is one, an endometrial biopsy. That's where I take this it looks kind of like a little coffee straw, and we put that through your cervix and take a couple cells of biopsy from your uterus lining. And then I send those cells off to the pathologist and I have them look at the cells under a microscope to see if they're healthy, because the pathologist can tell us if your uterus lining looks strong or if it looks weak. And then I also have them test for something called endometritis, or chronic inflammation or infection in your uterus. So we have them do something called CD138 stains for endometritis, where they're looking at plasma cells and white blood cells and things that could suggest inflammation or infection. And then we also have them grow the sample in a culture to see if it grows back any bacteria. And there's lots of different things that we see coming back on an endometrial biopsy. A weak lining is one thing that we often see. We see a lot of infections. Some people have yeast actually in their uterus, in which case we have to treat them with yeast medication. I've seen people that have significant bacteria growing in their uterus, in which case we have to do things like antibiotics or PRP washes or intrauterine antibiotic washes. So lots of things can come back that we can specifically treat so that we're not just guessing. The other evaluation that can be really helpful is to have something called a hysteroscopy, where we take a camera and put it inside your uterus and look around, because then we can look at things from a macro level and a micro level and take some samples of your uterus. So things that we'll see during a hysteroscopy, what you want to see is that your uterus looks really, really round and pink and homogeneous, like the inside of your mouth or the inside of your cheek. You don't want it to look scarred. Sometimes we'll see a lot of scar tissue throughout your uterus, or you don't want it to look stippled, because little dots in your uterus lining, that can be a sign that you have inflammation or infection. We want to make sure that we can see the entrances to both of your fallopian tubes, because if one of your tubes is blocked or if there's scar tissue over there, that can be an issue. We want to make sure there's no fibroids protruding into your uterine cavity. That could cause issues with really heavy bleeding or implantation. And we also want to make sure that you don't have any polyps. So if we're doing something called an operative hysteroscopy, then I use this little device that's kind of like a Sonicare toothbrush for the uterus, where I can go in and I call it giving your uterus a haircut. Meaning if you have any redundant endometrial tissue, polyps, dead cells, I can go in and cut off all the dead ends, kind of like a haircut, and clean your uterus lining really gently so that we're not doing any damage to your uterus lining and we're just cutting out any of the dead cells, to make sure that you're working with a really healthy, rejuvenated uterus. So for example, if you have chronic endometritis and we've treated you with antibiotics, we really want to make sure that we repeat the biopsy to make sure that the infection or inflammation is gone. If not, then I can go in and do a hysteroscopy, remove some of those bacteria, take off any biofilms. Biofilms are basically coating that your body can make around bacteria, and that can make them really resistant to antibiotic treatment. And I can go in and do an antibiotic wash where we put antibiotics directly into your uterus. One reason that that's really helpful is that you're literally putting the antibiotics right on the bacteria. You're not taking it orally, so it doesn't have the same effect on your gut as it does if you're taking it orally, and we can just directly work on the actual inflammatory cells and the bacteria directly. The other thing that I'll do is if you have scar tissue, for example, oftentimes I'll go ahead and shave down the scar tissue and remove it to get you to your healthy uterus lining. And then I also do intrauterine PRP washes and intrauterine PRP injections. So what we do is we draw your blood and we spin it down to the PRP, or just the platelet-rich plasma. So we take your own rejuvenating, healing cells, and I take this little teeny tiny needle. It's kind of having a little uterine facial. So I take a little tiny needle and I inject that PRP throughout the inside of your uterus to make sure that we're treating infection, we're preventing scar tissue from growing back, we're giving you the optimal uterus lining possible to prevent any miscarriages, make sure that the baby can implant properly and have excellent placental health and placental growth. So PRP can be a really rejuvenating therapy if we're struggling with a thin uterus lining, recurrent miscarriages, chronic infection, scar tissue, issues from having a previous IUD. There's that kind of rejuvenating therapy that we can do. So when we think about the health of our uterus lining, of course, everything that we do starts with nutrition. So we do want to make sure that we're getting enough vitamin sources in order to especially optimize blood flow to our uterus. So that's going to be some of our nitrous oxide, our vitamin E, and our antioxidants. The other thing that we want to look into is, okay, what are some of the supplements that we can be taking in order to optimize our blood flow and our uterus lining health? Oftentimes I'll recommend things like L-arginine is a fantastic amino acid that can improve blood flow to the uterus. Usually we want to be doing about 3 to 6 grams of that. Vitamin E is something that's also really helpful. And then we can also give those as an IV form. So if you feel like you're taking something and it's not working, oftentimes we'll give that in an IV. We actually have a uterus implantation IV where we'll give a lot of those vitamins IV so that we can get it directly into your bloodstream and get it to your uterus faster to help rejuvenate your uterus lining. Other therapies that we'll often use, just depending on every person's situation, you can actually give yourself vaginal Viagra. So the same Viagra that we use in men, the drug name is called sildenafil. And in men, it increases blood flow. And so we can do that to women as well. So we can do vaginal Viagra where we increase blood flow to your cervix and uterus and try to get that uterus lining thicker. We can also use something called pentoxifylline to help increase blood flow. If we think that there's a clotting issue and we need to work on thinning your blood, we can do things like low dose or baby aspirin. Other things that we use to improve blood flow to the uterus, we'll do sometimes injections or microdose HCG because that can really help reset some of those receptors in our uterus if we feel like our estrogen profile is not completely matching the uterus lining. And then other things that we'll do, for example, is estrogen therapy. So you can take oral estrogen to try to thicken your uterus lining, or we can do vaginal estrogen to try to thicken our uterus lining and make it healthy. So that's why it's really important to know what your hormone profile is, because if you're a low estrogen person, taking estrogen can help thicken your lining. But if you're a higher estrogen person and we don't want to increase the actual estrogen in your blood, but somehow your uterus receptors are not seeing that estrogen, that's where vaginal estrogen can come in and be really helpful so that we can just directly saturate those receptors with vaginal estrogen. And then other things that we think about for blood flow, we can also do some creams. In addition to vaginal estrogen, we can do vaginal DHEA. That's a cream that we can compound to help improve blood flow. And then of course, when we think of all things, we want to think about our nutrition and then our supplement. And then we also want to think about everything else in our life. So when we're thinking about our uterine blood flow, it is really, really important to be moving our bodies, because when we are getting our heart rate up, it's literally improving blood flow to our uterus. So we want to make sure that we're doing a little bit of cardio, at least 15 to 30 minutes, 3 times a week, so that we can get enough blood flow to support the uterus. So if you're a person who you're worried about your uterus lining, it seems like you have a really light or really heavy period, you've had recurrent miscarriages, you've had any procedures or an IUD or anything on your uterus where you would be potentially worried about your lining, please advocate for yourself. Make sure you get it evaluated. We are happy to help you. Your uterus lining is really important in your overall health and for conception. Thank you so much for joining us today on this episode of the Hormone Cafe, and please stay tuned for our next episode.